I'm Cynthia Buffington, and Dr. Buffington, and I am the Director of Research and Education at the Metabolic Medicine and Surgery Institute at Florida Hospital, Celebration Health. Celebration being the Disney community just outside the gates of Disney World. And I was asked to give actually 6 presentations here. One had to do with vitamin and mineral deficiencies that occur after gastric bypass. Secondly was to find ways or to discuss ways of improving compliance to the postoperative diet for bariatric patients, and to discuss foods that have anti-obesity actions and those that are actually fat-promoting foods. In addition, I have given actually 2 presentations on cancer and the link between cancer and obesity, and how obesity can increase the risk for many different types of cancer, and as well as cancer mortality, and how bariatric surgery can reduce both the mortality rates associated with cancer and the risk for cancer. Another presentation I was asked to give had to do with alcohol use and abuse after bariatric surgery. And I discussed how at least one of the procedures, gastric bypass, can lead to an increase in alcohol absorption, an increase in peak levels, so that after one alcoholic beverage, a person may actually reach those alcohol levels that would define them as being legally intoxicated. And how at least some studies have shown that the clearance of alcohol may be for a longer period of time in individuals who have had gastric bypass. So we warn our patients about these changes they may have, not to ever drink and drive, to know that one drink can actually lead to intoxication, and that they're going to feel the effects they'll be much more sensitive to the effects of alcohol. And we also point out some of the deleterious consequences of drinking alcohol. And of course, those are deleterious consequences for all of us, but perhaps a little more so for the gastric bypass patient, since the metabolism of alcohol has changed.